The Magos Bakri Balloon Placement Training Project, or MBBPT, brings together Quanta and Qualia, a deep tech company based in Greece, and University College Dublin, one of Ireland's leading research institutions. Together, they are collaborating to empower the next generation of training through the combined strengths of virtual reality, haptics, and 5G connectivity in the medical sector. Traditional VR training methods, often based on handheld controllers, lack the precision, realism, and tactile feedback needed for complex medical procedures, like Bakri balloon placement, where dexterity and a true sense of touch are essential to immersion and skill development. In addition, the absence of remote support and real-time collaboration has long limited the accessibility, scalability, and agility of surgical training across the globe. The Magos Bakri Balloon Placement Training Project sets a new standard in immersive medical education through the integration of hapticos exoskeletons and 5G network. These advanced exoskeletons offer sub-millimeter hand tracking accuracy and lifelike haptic feedback, allowing users to physically feel and manipulate virtual surgical tools, such as the tenaculum and speculum, with exceptional precision inside a fully simulated operating room. Combined with 5G network technology, the MBBPT project not only unlocks global accessibility, but also enhances collaboration, photorealism, and system responsiveness, enabling intuitive, seamless, and deeply immersive training that builds confidence, accuracy, and real-world readiness. To support the deployment of the project, University College Dublin established its own 5G infrastructure, specifically configured to meet the multiplayer, low latency, and high bandwidth requirements of the project. Following extensive scenario testing, the system was carefully tuned to deliver optimal performance for the demands of a real-time, haptic-enabled VR training environment. Following the completion of the VR surgical application integrated with the hapticos exoskeletons, the MBBPT project was fully connected to the FIDAL monitoring analytics platform, enabling real-time collection and sharing of 5G network KPIs, as well as application-level metrics such as frame rate, GPU, and CPU usage, directly to the FIDAL repository. Extensive pre-trial testing was conducted across the two independent 5G infrastructures at Patras University and University College Dublin to validate system stability and performance under real-world conditions. These tests led to key optimizations of the multi-user component, fine-tuning object synchronization, and haptic interaction consistency to enable real-time, stable, and lifelike collaborative training sessions. Major trial sessions took place in December 2024 and April 2025 at the National Maternity Hospital in Dublin. These sessions brought together both medical students and senior clinical professionals, providing valuable feedback from a wide range of surgical experience levels. The VR training application was designed with two complementary phases. The first focused on theoretical guidance through the Bakri balloon placement procedure, while the second allowed participants to apply that knowledge in an immersive practical simulation. Each session included two key users. The trainee was responsible for completing the experience, while a technical supporter was present to offer guidance and assist in case of any technical difficulties. Through these structured, hands-on scenarios and real-time remote feedback, the project demonstrated its potential to enhance procedural accuracy, build user confidence, and accelerate the learning curve in one of the most critical obstetric interventions. The trial sessions at the National Maternity Hospital provided strong evidence of the impact and potential of the MBBPT project. Quantitative data and participant feedback showed a clear improvement in training outcomes. Confidence levels increased significantly, with average self-assessed confidence scores rising from 1.78 to 2.97. More than 86% of participants reported that the VR training improved their understanding and skills in managing postpartum hemorrhage. The majority described the system as easy to use, comfortable to wear, and well supported with appropriate cues. Over 90% said the experience supported their learning process, and 89% would recommend it to fellow doctors. Trainees appreciated that the training felt tailored to their level, and 94% described it as an overall enjoyable experience. Notably, 87% of participants said they would prefer this VR approach over traditional didactic lectures. Some participants reported minor side effects, such as dizziness or eye strain, a common and manageable reaction during longer VR sessions. By combining experiential learning, haptic realism, and real-time remote collaboration, the MBBPT project shows how immersive technologies can make life-saving surgical skills more accessible, repeatable, and scalable than ever before. With growing clinical validation and strong user engagement, MBBPT stands as a powerful example of how haptics technology and 5G network can transform medical education for the better. This project has been supported by the European Union's Horizon Europe program under the FIDAL Open Call.